All right. Oh, man. All right. Sorry. Computer lagged. All right. Let's see. Let's do a little test review. Exam 8 test review, chapter 42 through 46. Uh, we'll knock it out at 66 questions. I'm not going to give you all the answers. I'm not going to give you any answers. But let's just kind of go through it, okay? So, and everything's random. I'm not going in any order or anything like that. Know the steps to replacing a oxygen bottle. Know the step-by-step how to do it and why you might blow out the bottle. Know the difference between a patient drag, emergency move, rapid extrication procedure, those sort of things. We've already gone over them. I know in another chapter. So know kind of what those are for. Go over your ambulance, like check off, starting, stuff like that, and know why it might be important to start the ambulance at the beginning of the shift. All right. Know some of the risk associated with 24-hour shifts. It doesn't tell me what chapter it's coming from, but what's one of the big safety concerns and one of the risks with having a 24-hour shift? Read up about due regard and common law and prudence and law of inertia. Read up on some of those, especially the due regard and what you might be critiqued on after a wreck. Nothing on there. Let's see what this one is. Know some of the conditions that are the most predictable and what you could be, how you could pre-plan for those. There's certain like traffic situations, like driving situations, that could be pre-planned. And when I say traffic situations, I mean like roadway driving, not to confuse you, because a certain question, one of the answers has the word traffic in it, and I don't want you to think that I'm telling you the words, that the answer has the word traffic, okay? That, actually, I'll give you that one because I've kind of confused myself on that. So just know if there's an answer that says, that has the word on certain question that says, anything about commuter traffic, that's not the answer. There's other three choices that you could pick from. Okay, no, it's kind of a common sense answer to the question, but just kind of know the advantages and disadvantages, and the comparison to fixed wing transport over rotor wing, and know the components of landing zones. This particular question has, when I did your test, when I took it, it had two answers that I picked, but that I thought were right, and I happened to have decided on the one that was actually the right answer. But just just know those components that go into it, things you're looking for, that sort of stuff. Know how to approach a helicopter. Know your role during a extrication. Know what your job is. Yeah. So this one, I'm gonna clear. I used in the video. I used the word when I described it, extrication tools. I'm gonna use. I didn't use book terms, so I wanted to clarify that. You have a hydraulic ram, hydraulic shears, which are also called cutters, and hydraulic spreaders. So know what those three are. Read up on SRS airbag systems in your book, and that'll help you with one of the answers to the question. I'm sure it has what you're going to need in it. Okay, so the different, I wish I had a toy car here. I don't. But anyways, so in a car, you have the two posts on the front, on the driver's side and passenger side, and then you have the post behind the driver's seat and passenger seat, and then you have the post behind the back seat, and it's labeled front to back. You have the A post, the B post, the C post. If you happen to have another post after that, it would be the D post, and so on. So remember, you have from the front of the car where lights, the windshield, those two posts, A post, B post, C post. You'll need to know that. Know where tempered glass can be found, and know where safety glass can be found, and how they break, how to get into them. Remember, try before you pry. Look up the purpose of extrication in your book. You'll want to know what that is for one of the answers, and also look up the EMS definition of rescue. What does the book say rescue is? What rescue is defined as? The EMS definition of it. We did not talk about this. I don't even think this was in the PowerPoint either, but read through your book, see if you can find anything. If you can't, when we Zoom conference, either later today or tomorrow, let me know, and I'll kind of answer this. But look up in the book about low head dams and why they're dangerous. You'll want to know that for one of the answers, and know the different types of stabilizer blocks. You have wedges, you have cribbing, you have step chocks. So know what they look like and how they might be made. It might talk about it a little bit in the book, and that might benefit you on the test. So don't forget about the NFPA 704 system, and that it is used where those labels are found. I said it in the video for sure. I know I did. All right. Go back over the start triage, and you might want to know what the first determining factor to that is. And I didn't go over it in the video, I know for sure. You need to know the METTAG system, METTAG triage system. You're going to need to know that. and how they classify their colors and what a patient has to present to be considered part of those colors. I didn't go over. There's quite a bit of hazmat on here, especially towards the end. But look up which radiation particles pose the least hazard to you. Know that if you're going to a scene of a detonated explosion, that what you might want to consider and assume will be there. Look up your different types of gases like cyanide, those sort of things, and might want to see if any of them smell a certain way. All right. You're going to want to know what the definition of disaster management is in the book. See if it gives you anything. You're definitely going to know that. And that's it. It's a pretty simple test. It's pretty common sense. So just kind of don't go too fast. Read the question. It's written like a National Registry test. There's a lot of which best describes, which is the first thing you do. A lot of that. So kind of keep that in mind. Slow down. Read through the question. Maybe read through it twice, and you can mark. If you think something's important in the question, draw a line underneath it. Okay.